Well, after we've dealt with thyroid and adrenals, and most people are much better from just dealing with these two things. You know, they may have a lot of other things the matter with them, but if they feel a lot better, we can be done. But if the patient comes back and says, you know, I'm just really still not up to par, much better, but there's just still something, or if they've been better and they come back and they're not quite right, I always remember to look for viruses. Viruses, once we have them, are always in the body. And so you can have a viral reactivation and not be actually sick, just not quite well. A common one that does that is the Epstein-Barr virus. You know, it's the virus that causes mono, the kissing disease. I had it in college. I don't think it was from kissing, but 2 weeks of high fever and misery, and it was very rememberable. You know, young people are not used to being sick that long. Well, that virus will always be in the body from the first time it expresses. It can be waked up by stress, by a toxic exposure, or sometimes we can't figure out what woke it up, but we can test for that through the blood and we can see if it's reactivated. If it is, there are ways to put them back to sleep. I'm happy to tell you. You know, some people advertise that they can kill these viruses and they never come back. I somehow don't quite believe that. But many doctors do give antiviral drugs, and that's their approach. I would rather just get them to go back to sleep, because they're going to still be some of them around, they're still going to wake up. So, and after viruses is the most complex and difficult topic to take on, which is the whole lifestyle of the patient. Obviously that gets discussed when we go over the adrenal test too. But when you think about it, we're designed to make energy. So if we're not making energy, then there's something wrong. And then I look to the diet, to the food, and I'm a little bit hesitant to bring up the topic because, you know, the average person really doesn't want you to touch their diet. They don't want to have to make that kind of a change. So I'm fond of saying suffering is a great teacher. If you suffer enough, then your mind is open. And I have patients who come, oh, no, just tell me what to do. I'll do it. And they actually do, and they get a lot better. So teaching people to eat in such a way that they support their blood sugar every day, and they get the nutrients that they need to make energy, and they can learn this for the rest of their lives, that is a great service. I have a few who have actually continued to practice what they learned, and they're still out there doing well. If any of this pertains to you, feel free to call our office today and make an appointment. We'll be glad to help you.